Uday is an attempt at creating a digital primary healthcare delivery and promoting public health solutions among the rural population who do not have access to primary care and who are living in far-off areas.
Telemedicine is definitely a game changer in terms of making healthcare more accessible and also to a large extent affordable. So according to the WHO, the doctor-patient ratio should be 1:1,000, one doctor per 1,000 population. But in India, it is 0.62 per 1,000 population. I mean, there is also a huge divide on how access to care is available for both urban and rural setting. So that here also there is a play, in terms of how telemedicine can bridge the accessibility of the doctors and specialists. Telemedicine would reduce a lot of travel for the patient itself, and also there is an immediate consultation and immediate care can be given.
In rural India, because of reach and limited amount of healthcare available, you need to be a one-stop shop. And we also realize that you need to be closer to the patient rather than expect them to travel 20-30 kilometers to come to see your clinic, our clinic, or to a hospital.
Training of rural youth for them to become health workers in a professionally certified manner, developing a software system, developing a medicine dispensation system, and identifying and collecting the diagnostic devices that are necessary to be able to provide primary care were the four major challenges that we started with.
Now that the pandemic has given that opportunity for the telemedicine to really be utilized,
we continue to operate pretty much at full strength, but we changed it. So for the first 3-4 months of the pandemic, we partnered with Digital India guys and promoted, or not necessarily promoted, but educated rural masses on what the pandemic is, what is the way they can keep themselves safe, how to disinfect and wearing a mask and benefits of this, that, other thing. So that's what we did for a period of 3, 4, 5 months. We think telemedicine will only be a complement to physical brick and mortar. Continuation of care can be through telemedicine, but start of care cannot be through telemedicine because you do need to do a physical exam, or you need to do some pathology or some radiology for proper diagnosis. We believe that start of care will have to be through a point of presence, and then continuation of care can be through telemedicine.
There is massive health inequity in India. There's a big chasm, it's not a gap. And as a result of such health inequity, hundreds of people are actually dying every day, not just because they're not getting hospital beds for treatment. There is bed shortage, but the question is, why are so many people needing hospital treatment at an advanced stage of their diseases, which require a large amount of money and therefore at a great risk of health poverty? The reason why disease burden accumulates in society is because rural people particularly do not have access to primary care, do not have access to public health policies and systems. The reasons are shortage of doctors, insufficient infrastructure, underperforming infrastructure even when they exist, lack of appropriate health technologies, both diagnostic and therapeutic, which work in our rural environment. a solution has to be found. It is immoral to allow such health inequity to persist in our society. The solution to create access and affordability of primary health care, which is of uniform quality and evidence-based, has to be found in a digital health platform.